Mold exposure and management of health effects. Concern about indoor exposure to mold has increased, along with public awareness that exposure to mold can cause a wide variety of health effects and symptoms, including allergic reactions. While there is strong evidence that dampness and fungi in the indoor environment can lead to significant disease, scientific research on the relationship between mold exposure and health effects is ongoing. There is, however, a developing body of literature documenting specific effects of mold on respiratory disease, allergic sensitization, and asthma severity. As an orientation to this course, let us review a clinical case study from the University of Connecticut Health Center's publication, Guidance for Clinicians on the Recognition and Management of Health Effects Related to Mold Exposure and Moisture Indoors. A 57-year-old elementary school teacher was initially diagnosed with asthma and subsequently a building-related respiratory disease. She was removed from the school environment for a few months under the doctor's orders, and this led to a nearly complete resolution of her symptoms. The elementary school building, where the teacher had taught for 20 years, had a history of poor indoor air quality. Based on her medical history and her response to removal from the school building, the teacher was transferred to another school building where she resumed her duties. Within a month, the teacher again became quite ill with respiratory disease. An investigation of the second school building revealed that the teacher's classroom was characterized by a moldy smell, wall-to-wall carpet on asbestos tile, water-damaged ceiling tiles, leaky skylights in the hallway, a crawl space under the classroom with mold, and a mulch pile outside window. The school brought in consultants and professional remediators to help mitigate the situation. Even after remediation and renovation, a number of plausible sources of exposure to mold still remained, such as an open window with mold-laden wood chips beneath it and an accessible plenum under a corroded deck with chronically wet areas. Major renovation work would have been required to address these two concerns. During remediation, the teacher was removed from the building and felt better at home. Once she returned to work, she became symptomatic again, as a few sources of exposure to mold still remained unaddressed. She eventually decided to retire from teaching, as she was unable to tolerate any further exposure. Over time, the symptoms associated with the respiratory disease became less frequent, and she required no medication. This case study illustrates that health complaints by building occupants are an important reason to investigate buildings for mold and other contaminants, to prevent mold growth, and to remediate existing problem areas. Furthermore, a moldy odor or musty smell suggests that mold is growing in the building and should be investigated. Finally, if remediation and renovation are unable to resolve the underlying mold problems and other issues, then building-related illnesses can be managed by changing the environment.